Hello everyone, please contact Professor Robert for a sample or a customized paper of the following or any other assignment. There's FPX4900, Assessment 2. Assessing the problem. Quality, safety, and cost considerations. Description. In a 5 to 7 page written assessment, assess the effect of the patient, family, or population problem you've previously defined on the quality of care, patient safety, and costs to the system and individual. Plan to spend approximately 2 direct practicum hours exploring these aspects of the problem with the patient, family, or group you've chosen to work with and, if desired, consulting with subject matter and industry experts. Document the time spent, your practicum hours, with these individuals or group in the Capella Academic Portal Volunteer Experience form. Report on your experiences during your first 2 practicum hours. Introduction. Organizational data, such as readmission rates, hospital-acquired infections, falls, medication errors, staff satisfaction, serious safety events, and patient experience, can be used to prioritize time, resources, and finances. Healthcare organizations and government agencies use benchmark data to compare the quality of organizational services and report the status of patient safety. Professional nurses are key to comprehensive data collection, reporting, and monitoring of metrics to improve quality and patient safety. Preparation. In this assessment, you'll assess the effect of the health problem you've defined on the quality of care, patient safety, and costs to the system and individual. Plan to spend at least 2 direct practicum hours working with the same patient, family, or group. During this time, you may also choose to consult with subject matter and industry experts. To prepare for the assessment, review the assessment instructions and scoring guide to ensure that you understand the work you will be asked to complete and how it will be assessed. Conduct research of the scholarly and professional literature to inform your assessment and meet scholarly expectations for supporting evidence. Review the practicum focus sheet. Assessment 2 PDF, which provides guidance for conducting this portion of your practicum. Note: as you revise your writing, check out the resources listed on the Writing Center's Writing Support page. Instructions. Complete this assessment in 2 parts. Part 1. Assess the effect of the patient, family, or population problem you defined in the previous assessment on the quality of care, patient safety, and costs to the system and individual. Plan to spend at least 2 practicum hours exploring these aspects of the problem with the patient, family, or group. During this time, you may also consult with subject matter and industry experts of your choice. Document the time spent, your practicum hours, with these individuals or group in the Capella Academic Portal Volunteer Experience form. Use the practicum focus sheet. Assessment 2 PDF provided for this assessment to guide your work and interpersonal interactions. Part 2. Report on your experiences during your first 2 practicum hours, including how you presented your ideas about the health problem to the patient, family, or group. Whom did you meet with? But what did you learn from them? Comment on the evidence-based practice, EBP, documents or websites you reviewed. But what did you learn from that review? Share the process and experience of exploring the influence of leadership, collaboration, communication, change management, and policy on the problem. But what barriers, if any, did you encounter when presenting the problem to the patient, family, or group? Did the patient, family, or group agree with you about the presence of the problem and its significance and relevance? What leadership, communication, collaboration, or change management skills did you employ during your interactions to overcome these barriers or change the patient's, families, or group's thinking about the problem, for example, creating a sense of urgency based on data or policy requirements? But what changes, if any, did you make to your definition of the problem, based on your discussions? But what might you have done differently? Capella Academic Portal. Update the total number of hours on the URS-FPX4900 Volunteer Experience form in Capella Academic Portal. Requirements. The assessment requirements, outlined below, correspond to the scoring guide criteria, so be sure to address each main point. Read the performance level descriptions for each criterion to see how your work will be assessed. In addition, note the additional requirements for document format and length, and for supporting evidence. Explain how the patient, family, or population problem impacts the quality of care, patient safety, and costs to the system and individual. Cite evidence that supports the stated impact. Note whether the supporting evidence is consistent with what you see in your nursing practice. Explain how state board nursing practice standards and/or organizational or governmental policies can affect the problem's impact on the quality of care, patient safety, and costs to the system and individual. O. Describe research that has tested the effectiveness of these standards and/or policies in addressing care quality, patient safety, and costs to the system and individual. O. Explain how these standards and/or policies will guide your actions in addressing care quality, patient safety, and costs to the system and individual. O. Describe the effects of local, state, and federal policies or legislation on your nursing scope of practice, within the context of care quality, patient safety, and costs to the system and individual. Propose strategies to improve the quality of care, enhance patient safety, and reduce costs to the system and individual. O. Discuss research on the effectiveness of these strategies in addressing care quality, patient safety, and costs to the system and individual. O. Identify relevant and available sources of benchmark data on care quality, patient safety, and costs to the system and individual. O. Document the time spent, your practicum hours, with these individuals or group in the Capella Academic Portal Volunteer Experience Form. Use paraphrasing and summarization to represent ideas from external sources. Apply OPA style and formatting to scholarly writing. Thanks for watching.